Thank you, Representative Judah, and appreciate all your work and your being here. And maybe I'll put this up a little higher, um, and all the progress you've helped create in Washington. Lord knows I've learned how hard that can be. Obviously, healthcare is top of mind for Coloradans as we're in now well into a second year of this pandemic, and we still have too many children and families that are forced to choose between paying for a child's life-saving drugs or buying groceries or paying rent. And I think getting that critical medical care too often pushes a family onto the edge of bankruptcy. It shouldn't have to be this way. Congress can lower costs, expand coverage, increase the equity in healthcare coverage, and in so doing can make us all safer. One thing we saw during this pandemic was that when there are such severe inequities in our healthcare system, it increases the risk for all of us. One key way we can strengthen our system is allowing Medicare to negotiate prices to lower prescription drug prices for families. I think also expanding vision, as the representative just said, is also crucial. Lowering premiums and closing the Medicaid gap in states that haven't expanded it, like we did here in Colorado. These are all things that work together to increase the coverage and increase the access to our health care and to control the cost inflation. Right now we're working on a reconciliation bill in Congress that I think is going to be the largest investment in middle class and equity, certainly in my lifetime. And I think in many ways we'll be able to invest in things like preparation for the next pandemic before we get there. Now, what we see through the pandemic is gross disparities, especially true when it comes to prescription drug costs. Nearly 1 in 3 Coloradans struggle to afford the prescription drugs they need to stay healthy. Nearly 53% of Coloradans are worried about how they will be able to afford the prescription drugs they know they need. Even worse, Americans pay 3 times more for their prescriptions than people in other countries. And millions of Coloradans, just like millions of Americans, can't afford their prescription drugs. All the while, we're seeing some of the largest profits in the pharmaceutical industry. I think giving Medicare the power to negotiate to help save patients and taxpayers billions of dollars is a good first step. I think by letting Medicare negotiate to lower prescription drug prices, it would save patients more than $150 billion a year, save the federal government close to $500 billion a year, and those are resources that would naturally be fit to expand access and make sure that we do increase coverage. I think lowering insurance premiums, another key issue here. The American Rescue Plan saved Coloradans thousands on health care. It lowered health insurance premiums, and think about this, it lowered health insurance premiums by an average of 49% on Connect for Health Colorado, our marketplace. 3 out of 4 Coloradans now qualify for plans or for support of these plans on the exchange with premiums of $25 or less. We're now over 216,000 Coloradans who've signed up for this plan this year, and that's an 11% jump over 2020, and obviously 2020 was a jump over 2019. The American Rescue Plan charges nationally. It's helped 4 out of 5 current marketplace consumers can find a plan on the ACA marketplaces for less than $10 a month. And in many ways, we've got to make sure that these additional support from the federal government makes these changes permanent. Healthcare not only has to be affordable, but it also has to be high quality and accessible. And we need to close those gaps in states which were not able to expand Medicare, Medicaid, and make sure that those disparities that expansion of Medicaid addresses so successfully, that we get them in all parts of the country. Every American has a right to quality, affordable health care. And I think we will all commit to making sure we continue to fight for equity.